day. I am Jazin May Lamusao, a student nurse of Southwestern University. So today I am going to perform an oral medication administration. So before we proceed to our procedure, we should have equipments that needed. First is we should have a disposable medication cup, a glass of water or juice or preferred liquids for the patient, a device for crushing or splitting tablets. This is an optional, and a clean gloves if we handling a medication, and also for the MAR or medication administration record, to or it should be electronic or printed. So for the assessment, check the accuracy and completeness of each medication administration record, or MAR, with the prescriber or doctor's medication order, and check the patient's name, medication, dosage, and route and time of administration. And second is assess the patient's knowledge the regarding the health of regarding the health and medications use. And third is to assess the patient's preferences of fluids, determine if medication can be given with preferred fluid. So for the planning of this procedure, so we should have collect the appropriate equipments, like for example the uh, disposable medication cup, the medication card, and the tablet that we give to the patient, and for the a cup of water. Next is to plan the preparation and to avoid interruptions, and do not take phone calls or talk with others uh, to avoid interruptions, and follow the agent's policy. Prior to the procedure, we should first perform hand hygiene. And for now, I already washed my hands. So we need to prepare for the medication to be given to the patient. So prepare medication for one patient at a time, and follow the 6 rights of medication administration, and keep all the pages of MARs for one patient together, or look at only one patient's medication administration computer screen, and select the correct medication from stock supply, unit dose, drawer, or ADS. Compare name of medication on the label with MAR, and see the illustration from the MARs or medication administration record, and exit ADS after removing the drugs. Before we get the correct medication, we should check first the expiration date of each medication one at a time, and if the expiration date is already expired, then return out to the dated drug or pharmacy. The next is check or calculate medication dose as necessary, and double check calculation. If needed, have another nurse to verify the calculations of the medication. If, if preparing a controlled substance, check the record for previous medication count, and compare current count with supply available. This is to control the substance loss, and loss requires nurses to carefully monitor and count the dispensed narcotics. So for the preparing solid forms from oral medication, is prepare tablets or capsules from a floor stock bottle, and pour required number into the bottle cup or the medication cup, and transfer the medication to medication cup. Do not touch medication with fingers, and return extra tablets or capsules to the bottle. And if to prepare the unit dose tablets for capsules, place packaged tablet or capsule directly into the medicine cup, and do not remove the wrapper. So we should put the tablet, and we should not remove the wrapper. So, so for the preparing the solid forms of oral medications, uh, Prepare the tablets or capsules from a floor stock bottle or pour required number into the bottle cup and transfer the medications to the medication cup. And do not touch the medication with fingers and return the extra tablets to the or capsules to that bottle. And to prepare for the unit dose, the like what I've used this medication for my patient, I should place the package tablet or capsules directly into the medicine cup and do not remove the wrapper of the medication because the wrapper maintains cleanliness of the medication and allows us to identify the medication name and dose at the patient's bedside. When using a blister pack, pop-up medications through foil or paper backing into a medication cup. Place all the tablets or capsule for patients in a one medicine cup except for the requiring pre-administration assessments like, for example, pulse rate or blood pressure. We should keep the medication into the wrappers. To keeping medication that require pre-administration assessments separate from other makes it easier to withhold medication as necessary. So if the patient has difficulty in swallowing and liquid medications are not an option, use a pill crushing device and clean crushing device before using it. If a pill crushing device is not available, place tablet between the two medication cups and grind with a blunt instrument. Mix ground tablet with a blunt instrument with a small amount, like for example a teaspoon of a soft food, and because large tablets are often difficult to swallow. Like for the kids, they don't want to uh, take the medicine large tablets, so we need to uh, scratch crush the tablets. And for the ground tablet mixed with the palatable soft food is usually easier to swallow. And cleaning pill crushing device ensures that the contamination of medication does not occur. To take the patient at the correct time, give time critical stat on single order medications and time order, and perform hand hygiene, or you can do the alcohol hand hygiene. Next is to identify the patient using at least two identifiers, like for example name, date birth, or account number, and according to facility policy. So compare the identifiers with information on patient's MAR's record or medication administration record, and compare the names of the medication on labels with MAR of patient's bedside. What's your name, ma'am? Your name again, ma'am? Explain the purpose of each medication and its action and possible adverse effects of patients, and allow patients to ask any questions regarding about the medications. So are you allergic in taking medicine, ma'am? No? Okay. So for tablets, some patients wants to hold the solid medications in hand or cup before placing into the mouth, and offer water or juice to help the patient swallow. So ma'am, we're going to take the medicine. So let me help you to sit in the sit position. Sit in the sitting position, ma'am. So this capsule, ma'am, is two times a day. So the time for now is 5 p.m. So we're going to take the one of the capsule. So can you hold the capsule, ma'am? Stay until patient has completely swallowed each medication and ask patient to open mouth if uncertain whether medication has been swallowed. So can you open your mouth, ma'am? Okay, done to taking the medicine. So dispose the soiled supplies and perform hand hygiene after the oral administration, medication administration. And lastly, evaluate the patient's response to the medication at times that correlate with correlate with onset, peak, and duration of the medication. Next is chart the medication dose, route, time, and date given on MAR immediately after the administering. So once again, I am Jocelyn May A. Lamusa, a student nurse of Southwestern University. So I hope I completely demonstrated on how the procedure of the oral medication administration. So that's it for today.